Dear viewers, today we will discuss very important topic, clinical method of educational psychology. First of all, we will discuss what is clinical method in psychology. Clinical method in educational psychology is the process of evaluating and treating individuals with learning and behavioral problems through a systematic and data driven approach. It involves a close collaboration between the psychologist and the individual to identify the root cause of the problem and develop a personalized intervention plan. Properties of the clinical method in educational psychology are: first one is assessment, comprehensive assessment of the individual's abilities, behaviors, and needs through a variety of tools and techniques. Second one is problem solving orientation, focused on identifying the underlying causes of learning and behavior problems. Third one is collaboration, close collaboration between the psychologist and the individual and their support system, including teachers and parents. Fourth one is evidence based, relies on empirical research and best practices to inform intervention decisions. Fifth one is holistic approach, takes into consideration the individual's physical, emotional, social, and educational needs. Sixth one is continuity of care, emphasizes long term support and monitoring of progress to ensure sustained improvement.